Hi everyone, today I will be outlining my community placement project which involves the evaluation of the Alfred Health Hand Service. Alfred Health is one of Australia's leading healthcare services and is comprised of three main hospital campuses, these being the Alfred, Caulfield and Sandringham hospitals, and has multiple community services including the Hand Service. A simplified version of the Alfred Health organisational structure can be seen on screen. Furthermore, there are currently 25 dietitians employed at the Alfred Hospital. There are also multiple inter-organisational partnerships of relevance to this project. These mainly relate to the companies that provide enteral feeding supplies to the Alfred Hospital. It is important to keep good relationships with these companies as ultimately without the feeds and equipment the hand service would not be possible. The dietitians at the Alfred Hospital provide medical nutrition therapy in a variety of clinical areas in both inpatient settings and outpatient clinics, and all dietitians are expected to be able to manage 10 patients. There are approximately 7 PEG-credentialed dietitians at the Alfred, and these dietitians have extra training allowing them to independently change, replace, and remove feeding tubes. This project was assigned by the Manager of Nutrition Services, and consequently, the evaluation of the hand service would fall under her role as well as under the role of the Nutrition Support Lead dietitian. And it is important to ensure maintenance of adequate nutrition in patients who cannot meet requirements through oral diet alone in order to decrease the risk of malnutrition-related complications. The local catchment for the Alfred Health Hand Service includes the local government areas listed on screen. There is limited hen population data on a state and national level, however at the Alfred there are currently 69 hen patients demonstrating a clear need in the community. Improving satisfaction will improve patient-centered care. However, the efficiency of the system as well as the patient and clinician satisfaction with the program have not been evaluated since implementation. The goals, objectives and strategies for the implementation of the HEN program can be seen on screen. When the program was implemented, a number of eligibility criteria were developed. Additionally, a number of procedures have also been implemented to ensure strategies of the program are being met. After tube insertion, the dietitian is responsible for providing the patient with written and verbal education prior to discharge and ensuring the patient is competent with using the feeding pump. All feeds and equipment are free for the patient and are supplied by the Alfred Hospital through funding from the Victorian Government. The hospital will supply the patient with a pump and 1 week of supplies upon discharge, including feeds, syringes and giving sets, and will place an order for the first month. A phone call will be scheduled monthly with a dietitian for a nutrition review and monthly ordering of supplies, and patients must also attend PEG clinic every 3 to 6 months. The PEG credentialing program was also developed to extend the scope of practice for dietitians and MATS registered nurses. Finally, a MATS PEG program was developed for patients with a PEG who require high-level care. MATS patients are reviewed by a PEG dietitian and MATS nurse every 3 to 6 months at the patient's place of residence. If a MATS patient resides in a high care facility, it is actually the responsibility of the facility to provide all enteral nutrition supplies. Our project is primarily focused on the evaluation stage of the project management cycle with a particular focus on impact evaluation strategies. In order to conduct the satisfaction surveys, low-grade ethics approval was obtained. Inclusion criteria for the patient satisfaction survey included all patients over the age of 18 who are currently on HEN, excluding MATS patients. All dietitians at the Alfred Hospital were included for the dietitian satisfaction survey. Development of both the patient and dietitian satisfaction surveys were commenced by our supervisors before the beginning of placement, however still required us to finalise questions and formatting. Patient satisfaction surveys will either be administered via email using REDCAPS, which was approved by ethics, post, phone call, or at PEG clinic. Subsequently, all dietitian satisfaction surveys will be administered via email. All emails must be sent by a dietitian from a secure email address as per ethics. However, phone calls and PEG clinic surveys will be administered by us. Patients will have 2 weeks to respond to the survey, with a reminder email being sent out 1 week before the deadline. Data will be analysed using descriptive statistics in Excel, as well as statistical analysis to determine correlations between the level of patient satisfaction and demographic data. Current practices will also be benchmarked according to the ACI Best Practice Guidelines for HEN. This will be achieved by interviewing a PEG-credentialed dietitian using the ACI Implementation Checklist. This data will be analysed qualitatively, and a compliance score will also be developed looking at the percentage of steps that have been successfully implemented at the Alfred. Maslow's hierarchy of needs, in particular the physiological need of food and water, was integrated into the needs assessment, planning and implementation stages of the project management cycle, as this service was ultimately planned and developed to provide adequate nutrition and fluid for patients who would otherwise not be able to meet nutritional requirements and thus would not be able to meet their physiological demands. Andragogy is the method of teaching adult learners. There are 5 key assumptions of adult learners that underpin the 4 key principles of andragogy. These principles can be related to the HEN program with a specific focus on the implementation phase of the project management cycle. Although guidelines have been developed regarding the frequency of reviews, patients are able to independently evaluate if they require more frequent follow-up. Conducting patient satisfaction surveys also allows patients to be involved in the evaluation of their care. Patients are required to demonstrate competency using the feeding pump prior to discharge with support which supports the theory that experience provides the basis for learning. Additionally, the education provided to patients is individualized and includes practical aspects of tube feeding and troubleshooting, thus allowing for problem-centered education. The basis of the HEM program is to ensure patient-centered care. Consequently, this approach is evident in each stage of the project management cycle, which can be seen on screen. Finally, here is a timeline of the 5-week placement with all time-sensitive elements marked with an asterisk. Thank you.